We are currently in the middle of the COVID-19 pandemic, and everyone on the media is talking about R naught. And the question on everyone's mind is, well, how do we know what our R naught is, and how can we know how well we are doing as a country? So let's talk about what R naught is first. Well, it's a number that summarizes the spread or contagiousness of an infection. For example, if during a period of an infection, a person who is sick on average infects 2 other people before they recover, then R naught is 2. If during the period of infection they infect 1 other person, then R naught would be 1, and if they infect less than 1 person, then R naught would be less than 1. Now, an individual person cannot infect less than 1 person. Some people may infect 1 person, others might infect none, but on average, each person would infect less than 1 person. As you can imagine, there are many things that can affect R naught. For example, washing hands, closing schools, social distancing, all affect the effective R naught of an infection. But my question is, well, how can we visualize different R naughts? And based on a video done by minutephysics, which I'll link to in the description, I've simulated infections with different R naughts and have plotted them on graphs where you have total cases on the x-axis by weekly cases on the y-axis for different values of R naught. Now, it's important to note that in these simulations, I'm assuming an infinite population in order to maintain a steady value for R naught. If I didn't do this, at some point the infection would burn itself out when so many people are infected that almost the entire population is infected and there'll be no one else to infect, so the R naught would automatically go down, and I didn't want to do that. The second thing I wanted to say is that when I say weekly cases on the y-axis, what I really mean is that let's say we're starting from day 7, we add all the cases from day 1 to day 7. Then I go to day 8 and I add all the cases from day 2 to day 8, etc., etc. And this is to avoid the fluctuations that can occur day by day due to noise. So you can think of it as a rolling week, and I may use the words days and weeks interchangeably in this video. The other thing I wanted to mention is that these axes have a logarithmic scale. That means they go up by powers of 10, and you can see each axis starts from 0, goes to 10, 100, 1000, etc. And while these scales are useful to use when discussing growth of infections like these, please be aware that exact distances on such graphs can be misleading and difficult to interpret. Another thing to know is that none of these axes show time, and days will be represented by the actual time and when a new dot will appear on the screen for each graph. I will show you the simulated data, and then I will show you some local data from Malta and what that looks like compared to these idealized graphs, and perhaps we can see some trends. So let's go ahead and start with a case where R naught equals 2. You can see that on this graph you have a straight diagonal line, and it takes about 51 days for there to be over 100,000 cases. So what happens when R naught equals 1? You can see that it takes much longer. We're already over 51. The line is still diagonal, mostly parallel to the other line. There are some jitters, and that's because this is an average R1. R naught equals 1, so sometimes it goes below 1 and sometimes slightly higher than 1, but on average you can see a straight parallel line. And now the interesting part comes. What do you think occurs when R naught all of a sudden goes below 1? And we're talking about 0.9 over here. So we start from roughly the same place, but we start seeing more jitters. And eventually, because every person infects less than one person, the disease dies out. So if we can get R0 to be less than 1, the disease will go away. Now let's have a look at what our local data looks like. As you can see, we start off pretty much at a very similar case as R0 equals 2, but we're going down slightly and we're getting much closer to R0 equals 1. And what our aim must be is to get that R0 down to below 1 so that the disease can be eradicated. And the only way we can do this is by staying at home, by practicing social distancing, by washing our hands, and by listening to our public health experts. Thanks for watching.